Good afternoon, everyone. My name is Sherry Lynn Garner, and I am the Program Specialist for Health Pathways Melbourne here at Eastern Melbourne PHN. I would like to start by acknowledging the Wurundjeri people and other peoples of the Kulin Nation on whose unceded lands our work in the community takes place. Eastern Melbourne PHN respectfully acknowledges their elders past, present, and emerging. We acknowledge the important contribution that Aboriginal and Torres Strait Islander people make in creating a strong and vibrant Australian society. Welcome to today's webinar, an introduction, or for some, a refresher on Health Pathways Melbourne. Today, I will show you how to access Health Pathways, how it can benefit your practice. I'll go through some tips and useful pages for practice managers. Then we'll go through the COVID-19 practice management page and a quick look at the content on the COVID-19 vaccination procedure page and the page on managing low-risk COVID positive patients. And in the end, we'll take some questions. First, how to access Health Pathways Melbourne. Health Pathways Melbourne is available to general practice teams and other clinicians in the Eastern Melbourne PHN and Northwestern Melbourne PHN catchments. To access Health Pathways, go to melbourne.healthpathways.org.au. If you don't have access yet, you can click on that Request Access button, which will bring up an online form. Or you can also email the team on info@healthpathwaysmelbourne.org.au. What you may not know is that all practices in the MFN and Northwest catchment already have automatic login to Health Pathways Melbourne. We have set up a unique URL or unique website link for every GP clinic in the catchment. This link allows you to bypass the login page. So when you send us a request to access, you will receive an email similar to the one on the screen. This email includes 4 bits of information. It will have a PDF of instructions on how to bookmark the unique URL. It will include the actual login details or username and passwords for GPs who may want to access the website from home. There is a notification there to let you know we are adding you to our mailing list, which you can opt out from anytime. And then it will include a link to your, it will include your unique URL in there, which is a series of letters and numbers that is unique to your practice. So you shouldn't be sharing this link to other practices. To bookmark this link, you will need to follow these next couple of steps. So these steps are specifically for those of you who use Google Chrome. If you are using another browser like Internet Explorer or Microsoft Edge, the steps may be slightly different, but you should be able to easily look for information online on how to bookmark in other browsers. So for Google Chrome users, open your browser and on your keyboard, do Control-Shift-O to open the bookmark manager. This is what the bookmark manager looks like in Chrome. Click on the 3 dots on the top right corner there, then click Add New Bookmark. You will see this screen with 2 fields. In the first field, just name your bookmark, which will be Health Pathways or Health Pathways Melbourne. And for the second field, just copy the unique URL or the link that you receive in the email and paste that into that second field. Click Save and you're done. We have a video on how to bookmark your unique URL as well, and Sally will kindly paste that link in the chat box now. When you open your browser again, you will see that Health Pathways bookmark in your bookmark bar at the top. If you hover your mouse over that link or that bookmark, you should see your unique URL, which means you have correctly saved that bookmark. We are in the process of moving to our new mobile-friendly platform. So once you've logged on, you will probably be on what we call the classic site, which is what you see on your screen at the moment. I encourage you to please try our mobile-friendly site by clicking that link at the top of the page. Most users will have compatible browsers, but if yours is not, don't worry, you can keep using the classic site as well. Once you are on the mobile site, you can set your preference. So click on those three dots at the top right corner again and select mobile platform or classic. For me, I've set mine to mobile friendly. So what is Health Pathways and how can it benefit your practice? Health Pathways is an online resource developed for general practice teams. It is a one-stop shop where you can access clinical advice, local referral information, and resources for clinicians and patients, all in the one website. The process of developing content for Health Pathways is a collaborative effort between local GPs, specialists, allied health providers, and other subject matter experts. Health Pathways aims to enhance clinical knowledge and promote best practice. It aims to reduce variation in care. Management advice and local referral guidance on health pathways help patients avoid unnecessary hospital admission, and it improves the quality of pre-referral workup and helps reduce referrals or the chance of a referral being rejected or delayed. Health Pathways is not just for GPs, it is for general practice teams. GPs use it for clinical guidance on the assessment and management of a range of conditions. It is particularly helpful for GPs when they have to manage an unfamiliar condition. However, it doesn't replace medical textbooks or clinical guidelines. It is a memory jogger or a practical resource that a GP can easily refer to during a consult. If you have staff who are new to the area, Health Pathways is a great resource because it provides local referral information for hospitals, community health providers, and other services in Melbourne. And what GPs love about it is that it is written by our local GPs for other GPs. For practice nurses, pages that may be of interest include immunization, our health assessment pages, chronic disease management, wound care, and action plans. And there are a range of resource pages that will help practice managers support the practice team. Here are some tips and useful pages for practice managers. The first tip is around how do you find what the latest changes are on health pathways. On the home page is the pathways update section. Here we list the top 5 most recent updates. So at the moment, most of the 5 or all of the 5 are around partial updates. But the updates could also include review of full clinical suites, or it could also include new pathways that have been developed. If you click on the view more updates, this takes you to the daily updates page, which gives you an expanded list of updates. And each one has a very brief summary of the changes made to that pathway. For example, on the 14th of October, we published updates to the colposcopy referral page to include statewide referral criteria and national cervical screening guidelines. Because of the numerous changes to COVID pathways, we have actually developed a separate page just for the COVID updates. One way of getting to that page is via that link at the top that says COVID-19 recent changes. Please note that this page is quite long because of the frequency of updates to the COVID information. You will need to scroll down to see the changes to different COVID pages. Another area to check for updates is the clinical editor's note, which is the yellow box at the top of the page. Most, if not all, the COVID pages have a CE note or a clinical editor's note where we highlight important and recent changes. Make sure you check the date to get an indication of when the page was last updated. By checking Health Pathways daily for updates, which you can give your team. So by checking Health Pathways daily for updates, you can give your team a heads up on what information has been updated, and you can probably use this as a tool that you can take to your team meetings, which you might do daily or weekly. The second tip for practice managers is around referrals. Although you are not the ones making the referrals, you may be asked to follow up a referral or to fax a referral on behalf of a GP. Firstly, if you've been asked to fax a referral, you can check if that service is still accepting faxes. For example, you've been asked to fax a referral to the Northern Health Gastroenterology Clinic. You can check the non-acute gastroenterology page, go to the Northern Health Service information, and if there is an e-referral option there, your practice and your practice uses MD or BP, that means your GP can send a referral via the health link form on the clinical software. And this is important because a lot of clinics in the Eastern Health, Northern Health, and Monash Health Services are now only accepting electronic referrals. The service information may also be useful. It includes specific referral forms. And if you need to follow up a referral, you can click the correct phone number on HealthPathways. Oftentimes, there is a direct number other than the hospital switchboard. As a resource, HealthPathways can support you with practice accreditation. For accreditation, some of the criteria may require you to have access to culturally appropriate or translated resources, or you may be required to provide patients with information in health prevention and health promotion, or for GPs to have access to information on safe and quality use of medicines. Ensuring your GPs have access to and use health pathways can help you meet all these criteria. Sally will be able to paste a link to this resource in the chat box. The next tip is probably the favorite of practice managers and GPs, which is around MBS items. Currently, we have two pages, one specific to COVID item numbers, and another one on more business as usual item numbers for things like diagnostic procedures, after hours consultation, minor procedure, and health assessments. Our GP clinical editor who worked on this have picked out these items most frequently used by other GPs and have put them in an easy to use resource page. So you will see it includes the name of the item number, and the value of the rebate. And here are some of the categories of other item numbers included in this page. The next tip is around statewide referral criteria. Hospitals in Victoria are now triaging referrals against statewide referral criteria. GP referrals for some conditions must meet the criteria, otherwise the referral may be rejected or delayed. Please let your GPs know that on the referral pages, they can access the statewide referral criteria drop-down box where they will find inclusion and exclusion criteria, along with other information that must be included in the referral. This includes any results of tests that must be ordered prior to referring a patient to a service. There are many other resource pages on Health Pathways that will be useful to know for practice managers. It's just a table that has some of those pages. You will need to go through the website, take your time, and I guess discover the pages that will be useful for you. But under COVID-19, you have those pages. Under our health system are the different resources. And further down, there's a forms and resources section, which has things like accessible parking permits, community transport, multipurpose taxi program pages. So lots of good resources to use, and you don't have to go into separate websites to access these resources. A few other pointers. So on the homepage is the latest news section, which has links to health alerts and advisories from the Chief Health Officer. For example, recently there was a warning on the use of potting mix. That link will take you through the Department of Health Victoria website where you will find the full announcement. We already talked about the pathway updates earlier, so I might skip through this one. On the right side of the homepage are some quick links or shortcuts to other websites like the Better Health Channel, RACGP Redbook, MBS Online, NPS Medicine Wise, PBS, and the National Health Services Directory. On the top of the page is the search bar. This is the easiest way to find a page, but you can also get a page via the table of contents on the left side. You can click on any of the arrows to expand the list. So if you open the Our Health System section, you can see there are more pages sitting under that heading. One of the most important elements on the website is the send feedback button, which is that speech bubble on the speech bubble icon on the bottom part of your page or your screen. You can use this to provide us any feedback, and we welcome any feedback. You can let us know what pages or information you have found useful. You can let us know if a link's broken, if a number hasn't worked, or you can also suggest other information which you think is a gap in the website. Now, I'd like to go through the COVID-19 practice management page. So starting from the top of the page is the date when this page was last updated. I grabbed the screenshot yesterday, and the version I was looking at was updated last 20th of October. In the clinical editor note is a recent update section, and I've highlighted some of the updates done. We added the GP priority line to call if your practice has become an exposure site, and there's also a link there for the risk exposure matrix. Further down the page is a section on coordination, where you can find links to some useful resources around preparing a COVID-safe plan and a link to the emergency response planning tool. The section on infection control covers information on what you can do to reduce infection in the practice. So the topics under here include how to set up your practice, what actions staff can do, and what we can tell patients. Next section is the care delivery during an outbreak, for guidance on how to minimize the impact on a practice if it becomes exposed to a person with COVID-19 during the infectious period. Here we have PPE guidance, how to prepare the practice for COVID-19, how to protect vulnerable patients, how to protect staff, how to manage unwell patients, including what to do if you can't do telehealth consultation and the GP has to see the patient face to face. You will see or notice that these arrows open to drop-down boxes for further information. So for example, currently our state's risk rating is COVID Black. So if you want to make sure your practice has tier 1 PPE, but you can't remember what that includes, you can click on that link or open that box, and it tells you what the minimum recommended PPE is. The next section is around responding to a COVID positive case in the clinic. There is guidance on how to assess the situation. This includes a link to the risk exposure matrix again, and the definition of a close contact. Then we have information on how to manage the situation. So it includes reminders to advise primary contacts to isolate, for example, advice around deep cleaning, what to do if you are a tier 1 exposure site or if you're a tier 2 exposure site. And if you become a tier 1 exposure site, what steps do you need to take? Then finally, the information at the bottom of the page is the information section where we list the different resources relevant to this topic. The next page is COVID-19 vaccination procedure page. I'm not going to go through the page in detail, but just wanted to show you the topics included. So on this page, we cover preparing the practice to provide vaccination, preparing for each vaccination session, triaging, screening, and eligibility, assessment of vaccine suitability, dose interval, and risk, informed consent, benefits, risks, and side effects, vaccine administration, and follow-up, adverse events, and ongoing management. And then we have on the second half or bottom half of the page is the vaccine referral information. It includes information on referring to the Victorian Specialist Immunization Clinic or VICSIS, and a number to call regarding cold chain breaches. The other page that you might come across more frequently now is the pages on managing low-risk COVID positive patients. So currently there are 4 pathways to support the management of low-risk COVID positive patients. One for Eastern Health, one if you're working with Austin, a separate one for the West Metro cluster, which is probably not relevant to the group today, and a fourth one which covers the Southeast catchment. Just wanted to let you know there is a lot of ongoing work to streamline the COVID positive pages for the Northeast Metro region. But as a general guide, these are the information available on these pages. So once you've been notified of a low-risk COVID positive patient, you can find on the page criteria for low risk, medium risk, and high risk. There's guidance for when and how often to book a telehealth session with your patient to assess their situation. There is a link there that provides the GP a clinical features script. So this contains guide questions to ask the patient to assess their symptoms, if they have new symptoms, or if their health has deteriorated. And if the patient has deteriorated based on the risk factors on the page, then there are phone numbers there to escalate them to either medium or high risk. There's also information on when the patient will be released from isolation. And for those patients who experience ongoing symptoms following COVID-19, there will be a link there to a separate page on post-COVID conditions. Again, a summary page just to show you the range of COVID pages on the site. And that box in yellow are the ones that are more relevant to practice managers. I think that's it. So thank you. Now I think we have time for some questions.
Carolyn, there's actually not any in the chat box. Oh, no, I've just got one come in. No, just saying thank you. So if you want to enlarge on anything you've been talking about for a couple of minutes.
Yep. I might go back to the screen with the list of resource pages because I know I went through that really quickly. Sorry, there's a few, it was a few slides back. Here we go.
And I've just had a question. Can we have these slides emailed to us, please? Yes, absolutely. I will be emailing the slides, and this has been recorded as well. So you'll also get a copy of the recording too.
Perfect. And like I said, if there are any questions, there's that send feedback button on the page, and we check the back end of that every day. So we either escalate questions that are more clinical to our GP clinical editor, or depending on the question, you know, we'll try and help you as soon as we can. All right, well, I guess if there are no more questions, Sally, we can end the webinar.
Sure. No, I think that was great, really informative. And as I said, you know, everybody will get a copy of the slides and the recording, so you can watch it again, or, you know, even other staff, you can get to watch it as well if they didn't have the opportunity to come on today. And it will also be on our website too.
Great. Thank you very much, everyone, for coming.
Thanks, everyone.